SARS-CoV-2 virus, the etiological cause of COVID-19 pandemic, is transmitted in the form of airborne droplets, which enters the body through the nose or throat, passes to trachea, and infects lung epithelial cells, eventually causes serious respiratory disorders. SARS-CoV-2 virus has intracellular infection mechanisms through the binding of ACE2 receptors in the bronchial and pulmonary epithelial cells to the spike proteins on the surface of the virus. Virus then invades into human cells, proliferate by replication, packaging, and escapes from the cells. Replicating viruses induce immune cells such as macrophages and dendritic cells to gather around inflammation area. Viruses then invade inside the immune cells, activating immune cells via toll-like receptors expressed on the cell surface or in the endosome. In case of SARS-CoV-2 virus, the single-stranded RNA of the virus is recognized by toll-like receptor 7 and induces immune responses. While double-stranded RNA, which arises from viruses such as rotavirus, is recognized by toll-like receptor 3. Virus infection leads to recruitment of inflammation-associated transcription factors, known as IATFs, such as cytoplasmic NF-kappa B. Activated NF-kappa B binds to a nuclear transporting protein called importin, forming a NF-kappa B importin complex, and enters the nucleus through a nuclear pore. Nuclear translocated NF-kappa B binds to a DNA, which contains protein information of pro-inflammatory cytokines and initiates gene transcription. In this process, pro-inflammatory cytokines such as TNF-alpha, IL-1 beta, and IL-6, and chemokines including MCP-1 and MIP-1 alpha are produced, resulting in a systemic immune responses. In normal cases, cytokines and chemokines produced by viral infection helps to fight against viruses. However, in case of SARS-CoV-2 viruses, they also activate nearby immune cells, thereby producing even more cytokines and chemokines, forming a condition known as cytokine storm. Cytokines spread throughout the body via blood vessels and cause serious inflammatory reactions with various side effects such as killing immune cells. As a result, systemic organ damage and immune system destruction occur, and the patient's condition exacerbates and develops into a serious illness. The organ that is most affected by SARS-CoV-2 virus-induced severe inflammatory reactions is the pulmonary bronchial tubes. The proliferation and inflammatory reaction of the virus induces lung swelling and pus filling in the alveoli, making it difficult for gas exchange. As such, acute respiratory distress syndrome is a major symptom of severe COVID-19 patients. Cytokine storm not only causes lung damage, but also causes blood clotting, shock, lung injury, cell death, immune paralysis, and renal failure. These life-threatening symptoms lead to hyperinflammation, immune cell destruction, and organ failure, resulting in death. Activated cytokines spread throughout the body through blood, causing excessive inflammatory reactions. In particular, by stimulating the blood vessel wall, it thickens and causes abnormal coagulation. Thrombosis occur along with small microthrombi in blood vessels, and platelets fibrin and coagulation factors are suddenly consumed, activating fibrinolysis, and hemorrhage occurs simultaneously. Cytokines released from immune cells withdraw the blood and stimulate and activate more immune cells, inducing a systemic inflammatory response. In particular, the spleen is the major peripheral immune organ composed of various immune cells. However, due to the viral infection and inflammatory reactions, the spleen becomes enlarged, swollen, and loses its function. Many formidable diseases such as cancer, pulmonary diseases, neurological diseases, autoimmune diseases, cardiovascular diseases, Alzheimer's, type 2 diabetes, and arthritis are all affected by the systemic inflammatory responses. To treat patients suffering from severe inflammation, including COVID-19, Salisbury developed an innate immunity regulating antiviral anti-inflammatory immunotherapy agent, iCP-NI. iCP-NI is a novel COVID-19 therapeutics consisting of Salisbury's proprietary TSD platform technology, the third generation hydrophobic CPP, and a therapeutic peptide NLS. iCP-NI spreads throughout the body via bloodstream and enters the lung tissue, which is the major infection site of the virus. The cell's phospholipid bilayer can be directly penetrated thanks to the Salisbury's proprietary TSD platform technology, the AMTD portion of iCP-NI. The NLS portion of iCP-NI that enters the cell competitively binds to important alpha-5, inhibiting the nuclear translocalization of IATFs. Therefore, the expression of pro-inflammatory cytokines is suppressed, showing a strong anti-inflammatory effect. Finally, the excessive immune responses and inflammatory responses can be controlled in the body of the patient administered with iCP-NI by suppressing cytokine storm, damage to lung tissue and other inflamed organs, and destruction of immune cells, ultimately allowing the patient to recover. COVID-19 is a unique infectious disease that we have not been experienced so far. Yet, in near future, we are still in risk of facing new potential infectious diseases. Whenever new pathogen appears, it will take substantial amount of time and money to make a suitable treatment. In this respect, suppressing excessive immune response of the human body caused by an infectious agent is the most logical and effective countermeasure against another pandemic to come, and iCP-NI can be a potential drug that can play this role.